All right, guys, welcome back to part 2 of Hindenburg versus Clover Health. I want to talk today about the allegations about the Clover Health Assistant as well as about upcoding. The two are actually related. I'll get to how that works. Stay tuned. All right, Clover says that their Clover Assistant is primarily a tool to improve patient care. Hindenburg has a different opinion. They say that according to multiple former employees, Clover software is primarily a tool to help the company increase coding reimbursement. Let's talk about how that works. So the Clover Health Assistant, I showed you that in my original video about Clover a couple of months ago. Just as a reminder, Clover is trying to use technology to improve overall outcomes with Medicare Advantage. They think that if they have healthier patients, that they will use the system more, and thus fewer costs for patients and more money for Clover Health. Now they're using something called the Clover Assistant, and what this is it's similar to an electronic medical health record that all physicians' offices are using now. Quite honestly, these systems can be quite cumbersome sometime, and I think that this one is like the rest of them in terms of it can be just a pain in the butt. However, I think that Clover tries to design theirs to suck less than the rest. So this is an example of what the screen would look like with a Clover Assistant that the physician who's seeing a Clover patient would be using. Now, there is some incentive for the doctors to use this system, and we'll talk about that. Clover says that this helps identify disease burden at the point of care, and again, potentially if they can have healthier patients, then those patients will use the system less and save everybody money, making Clover money. Now, they have been employing this for a couple of years. The bar graph shows how the rate of usage of the Clover Assistant with members who see their primary care provider, the PCP, primary care physician, how that has been going. They show as a long-term goal to get it up to 70%. Now, this is important to point out because one of the allegations that Hindenburg leveled against them had to do with them hiding the numbers of providers who were actually using the system. Again, Clover was upfront about this. You just have to look at the details to understand. So what Clover said was that 92% of the onboarded primary care providers used the Clover Assistant for 92% of the eligible visits in 2019. The key here is onboarded primary care providers. Now, they talk about what constitutes an onboarded primary care provider. It says that there's 1 hour of onboarding training needed. So if a provider hasn't undergone that 1 hour of training, then they're not an onboarded provider. Clover didn't emphasize this, but they weren't hiding it either. Now, in return for using the Clover Assistant, there are some advantages for the provider. Number one, they get reimbursed at 2 times the industry reimbursement rate. Clover was upfront about this. One of the allegations with Hindenburg made it sound like they were hiding it. Well, they didn't actually disclose how much money they pay. The answer is that they pay $200 per visit. That's a lot. But they were upfront about it. They did say that the doctor is going to get reimbursed at 2 times the industry reimbursement rate. And the other advantage is that the provider is going to get paid quicker, an average of 4 days. 4 days to come up with a payment. I've seen somewhere else 7 days. But, you know, that's still very rapid for a provider to get their payment. They go on to say that it's about 5 minutes of average time spent interacting with the Clover Assistant. Still, that's 5 minutes. You start adding those up over multiple patients per day, and you can see that that could be an hour or more that a provider might spend interacting with this system. Now, the complaint about this system is that while the system is trying to improve medical care, it also brings up old data that might not necessarily be applicable for the current visit. For instance, say a patient had COVID-19 and now has recovered from it, but the Clover Health, Clover Assistant keeps showing that the patient has COVID-19. So it may look as if the patient still has COVID-19 rather than that they had it previously. One of the complaints then from a provider that they interviewed says Clover is constantly throwing those codes, those are diagnosis codes, back in our face for everything that's ever come up when they are irrelevant now. A provider they interviewed said that they have all these ridiculous diagnoses in there that make no sense, that half the time they aren't right. Whereas with a different insurance carrier, they would say it's 4 to 5% of the time that the diagnoses aren't correct. They also state that the doctors explain that the software limits their ability to remove an inapplicable diagnosis. Now, notably, Clover says in their material that this Clover Assistant gets updated every 3 weeks with feedback from their providers so that they can update problems that are seen. Clover states in their reply to these allegations, note that when a physician tells us a diagnosis is not currently relevant, we do not show that diagnosis again that calendar year, which obviously means that the following calendar year it is going to show up again. So when you see these patients again in January, you're going to be trying to remove a lot of previous diagnoses. That is going to be a little bit of a hassle for a medical provider. But once those are removed, they shouldn't see them again until the following calendar year. Now, to understand upcoding, there are two things we need to go over. One is CPT codes, and the other one is how Medicare reimbursement occurs. So every provider, after they see a patient, they need to provide a CPT code for that visit. It essentially documents a level of care. A common code that gets used is 99213 versus a 99214. Now, generally a provider gets more money for a 99214 than they do for a 99213. And what's the difference? Well, you can see history, it's just expanded problem for a 99213 versus detailed. The exam is just kind of problem focused for a 99213 versus a little more comprehensive for the 99214. And the level of decision making is low for a 99213 and moderate for a 99214. So if a provider gets paid more for doing a 99214, there can be some incentive built in for doing a little more history than you might otherwise do, or a little more exam than you might otherwise do. It's hard to change the level of decision making. That's kind of the mental work that the provider does when they're trying to figure out the problem. Now, in order to claim a 99214, you have to have at least two of the three on this 99214 level. Same with a 99213. There is a lower code, 99212, which is, just kind of a straight up thing, like a patient who has a wart. Anyway, it's a little bit different when it comes to this Medicare reimbursement. I mentioned earlier that Clover pays the provider $200 per visit. Now, this isn't just to use the Clover system. The Hindenburg report makes it sound as if the provider is getting an extra $200 to use the Clover Assistant. It's $200 per visit. So, a 99213 might be $130. That's what it was when I saw one of my doctors back in the fall. So if that's the case, then the doctor's getting an extra $70 to use the Clover Assistant. Now, if it's a 99214, the provider's getting less for using the Clover Assistant than they might otherwise, but regardless, they're getting $200 per visit. So the provider in this case is not incentivized to upcode. Regardless of how they code it, they're going to get a flat fee of $200. So why is this important? Well, the reimbursement for Medicare Advantage is different than the usual way. They talk about, this is from Medical News Today, they talk about private insurance companies administer Medicare Advantage plans. These insurers have a contract with Medicare to provide benefits from Parts A and B. If you're not familiar with Medicare and the different parts, please go back and watch my original video about Clover Health, and I explain in detail how the Medicare system works in America today and what these different parts entail. Medicare will pay the insurance company to administer an individual's benefits each month. The individual remains responsible for out-of-pocket expenses. So the Medicare Advantage plan is getting a payment from Medicare to provide services for this patient each month. That means even if the patient didn't have a visit with a provider that month, the Medicare Advantage plan is still getting paid. So these Advantage plans are getting paid by Medicare as a flat fee essentially every month. That's a good deal for Medicare because they sort of limit their expenses, and it puts some of the onus on the Medicare Advantage plans to take good care of their patients. Now, Medicare understands that sometimes patients with a lot of medical problems are going to be more expensive to take care of, and so they increase the flat fee that they pay to the Medicare Advantage plan for patients who are sicker. That's where the incentive to upcode potentially could come in. Now, if we go back to these diagnoses that we talked about that remain on the Clover Assistant that the providers are trying to get rid of, if it looks like the patient has XYZ diagnosis when really they only have AB and not the XYZ as well, then the patient looks like they're sicker. So the complaint is that Clover Health is using their Clover Assistant to upcode, thus make it look like the patient is sicker, and thus receive a larger payment from the Medicare people for that patient every month. Now, interestingly, Clover does actually have sicker patients enrolled within their plan. So the question is Clover capturing the total level of illness that a patient has, or are they ignoring diagnoses that really don't apply anymore and trying to keep them on the list so that they can make the patient look more ill? Now, I have not dealt with the Clover Health Assistant directly, so it's hard for me to answer that, but having dealt with the Air Force's electronic medical record in the past, I would say that it probably falls somewhere in between, that they're not necessarily trying to defraud the government, but they are trying to capture dollars that might otherwise go uncaptured. Now, another complaint in the Hindenburg Research article says that Clover claims that its software delights physicians. And then they say, reality, Clover has to pay doctors $200 per visit. We've already explained where that $200 comes from. The part about that their software delights physicians, I would say that probably no software is going to delight physicians. Physicians want to do medicine. They want to take care of patients, and they want to move on and take care of the next patient. And everything that requires them to click a button or sign something or anything else is a nuisance. Between these two videos that I've done, I've covered the bulk of the questions that Hindenburg Research had for Clover Health. What is my take on all of this? I think that Clover could have done better. They obviously had some areas within their business that were going to smell once they were exposed. And we talked about some of those. I think that some of these other attacks can be explained. For instance, why are they paying providers $200 to use their system? That's just a flat fee, as I explained. I'm still in on Clover Health. I bought the dip. I still see this as a company that provides a good service. What will it mean for Clover Health if this inquiry that they responded to actually becomes something more serious, a full-up investigation? Well, as I stated in the previous video, the penalty for Medicare fraud can include a very large financial penalty, and it can also include up to removal from the Medicare system. And as far as I'm concerned, I personally have not sold my shares, and I bought some more shares today while the price is a little lower. I hope this was helpful for you. Again, do your own due diligence. This is not financial advice or medical advice. If it was helpful for you, please give us a thumbs up. That's always helpful for us on our YouTube channel, and we'd love to have you as a subscriber. If you have any other questions about Clover, please feel free to leave them in the comments, and I'll try to respond as best I can. Until next time, enjoy your investing.